Hello, this is AJ Diliberto. I am a health insurance agent out here in California. And before we start open enrollment, I just wanted to put together this video to explain the differences between HMO, EPO, and PPO plans. What I find is that a lot of people make decisions on which healthcare plan to buy, but not necessarily for the right reasons. And so I just really wanted to make sure everyone understood what they were, what they weren't, answer some questions, and see if we can help people to make a better decision as they go into this new open enrollment period. So what we have here is you have an HMO plan. Let's start with them first. I think a lot of people are familiar with these. An HMO plan is where you must go to see your primary care physician first. So no matter what your situation is, so if you've got a skin lesion, you don't like the looks of it, or you've got a headache, or whether or not it's something even you've broken your leg or something, you're still going to go to see your primary care physician first, and then they'll give you a referral to another doctor that's in network. So that's how HMOs work. Now, you must stay in network with an HMO. You can never buy outside. If you go to an outside doctor, then that's a cash pay, and the insurance company will actually provide zero benefit to you. So now let's go over here to the PPO side, where we have another unique scenario where, in this case, is the exact opposite. You do not have to stay in network. And I put a little star here to say here that, and this was not always this way. So this is going to be some new information for some people who have used PPOs in the past, maybe with their company and something like that, and it really wasn't this way. But today, and again, at least in California, and I'm pretty sure it's everywhere else in the country, is it's going to cost a lot more to go outside of network. So in this case, you're going to have a deductible that's about 2 times as much. Your out of pocket, what they call max out of pocket, which is as much as you can spend, is going to be, again, about double. But then there's another factor, which is if you use an in-network doctor, then the insurance company is going to have a negotiated rate that's less than what you'd normally pay. And so you're not going to get that negotiated rate. And the insurance is not necessarily going to pay the rate of whatever that doctor or hospital is. They're going to pay what they believe, what they call customary. Let's see if here I can write it. Customary and reasonable. Okay, sorry, my handwriting is not that good, but that's what's going to happen. So again, if you have a cost that, let's say, is $20,000, and Blue Shield, let's say, says, no, you know what, we think, oh, it's all blurry there, that they say, no, we think that that's only $15,000. So they're going to pay you on the $15,000, and this additional $5,000 is going to be to you. So you can see that in this PPO out of network, if you go out of network, you can pay a lot more. So I just want everyone to know that PPO doesn't mean go to any doctor you feel like it and everything's covered just the same, because that's not true. It's covered and you can go, and there's a ceiling. So let's talk about when this would make sense. This would make sense if you let's say you had a rare brain disorder and you need the best of the best of the best doctors, and that doctor is not in network. Well, you could go to that doctor, and even though it would cost you more, let's say it cost you $10 million. Well, you're going to have a ceiling. Maybe your out-of-pocket's going to be $30,000 or $40,000 instead of the normal $10,000 that it might be. But again, you got the best of the best and you had coverage. So that's really the reason why you want a PPO, is that it just gives you this added layer of, let's say, peace of mind and security that if something really, really bad happened and you needed to find a doctor that wasn't in network and you couldn't find anybody that was a good doctor that you wanted to use, then you would actually use this out-of-network PPO benefit. But otherwise, I strongly encourage you to stay in network, right? To stay in network. Oop. I've really never written doing that before, but okay. So anyway, that's that. Now, let's look at this EPO, because it's very interesting. As you see, the EPO was designed to take the best of both worlds and kind of mix it. And really, the original intent was to make it be less money than the PPO, but a little bit more money than the HMO. It's not really happened exactly like that in all cases, but let's just look here. So just like the HMO, you must stay in network. There's no out-of-network benefit in an EPO. But like at PPO, you don't have to go to your primary care doctor first. You can go directly to a specialist, okay? And as long as they're in the doctor network, so if you have that skin lesion or something that we were talking about earlier, you can go directly to a dermatologist, and that's no problem at all. So that's kind of the EPO. Now, this was designed, and I think many people think that this is the cheapest, then this is the second cheapest, and this is the most expensive. And while sometimes that is true, it is no longer the absolute truth. So people come to me all the time and they say, you know what, I want to save money, just give me Kaiser. Well, that worked many years ago. That was actually a solution, that you could use Kaiser, which is an HMO, and that would mean that you got the less coverage. But it's not necessarily the case. Now, in California, there are HMOs that are the lowest cost. Molina happens to be one, and LA Care is another down here in Los Angeles and Orange County. So there are HMOs that are the cheapest. But Kaiser, which is also an HMO, has tended to be the most expensive. So again, just saying HMO doesn't necessarily fix your situation. It just is just a type of plan that you need to be aware of. And again, there are some PPOs that were very, very expensive and some that were very reasonably priced and actually even maybe a little less than an HMO or an EPO. But by and large, this is kind of what we're talking about here. So I think that when you look at this, a lot of people say, well, why wouldn't I do an EPO? And honestly, that's what I have. I'm okay with the EPO because I'm okay. I know that I'm going to find a good doctor in network. Okay? And so if I can't have the best of the best of the best of the best, then that's okay. And also realize that after 1 year, at the next open enrollment, if I really wanted to switch plans and go to a different doctor and a different EPO, I could make that change on January 1st of the next year. So we're really only making a 12-month decision here as it is. So I'm okay to make a 12-month decision to stay inside my EPO. Got to make sure my doctors, I pick doctors, and make sure that the hospitals I want to use are in network. Okay, can't go to, like for instance, there's a plan called Oscar. And Oscar has UCLA Medical Center up in Los Angeles. That's in network. Cedars-Sinai is not in network. So if you have to go to Cedars-Sinai, then Oscar's EPO would not be good for you. However, if you're okay to go to, either of those two situations, then fine, then that would be good. And especially if that's the lowest cost plan and you're okay that you can't go to Dr. Oz if you need your brain surgery and you don't really necessarily want to have to deal with this primary physician, then the EPO is going to be right for you. And it's going to be right for a lot of people. So I think that handles most of the questions that I get on these three topics. So hopefully you found some value here. And this is AJ Diliberto signing off, and happy open enrollment period.